Our next presenter, Hiroyoshi Yokoi from Japan, who's going to present the Zilver PTX Post-Market Surveillance Study in Japan, the 24-month results. Professor Yokoi.
Thank you. On behalf of the investigators, it is my pleasure to present the 24-month results from the Japan Post-Market Surveillance Study of the Zilver PTX drug-eluting stent for the femoral popliteal artery in real-world patients with more complex lesions. As shown here, the Cook Zilver PTX clinical program will enroll more than 2,400 patients treated with the drug-eluting stent. This clinical program includes 3 pre-market studies, the pivotal randomized controlled trial RCT, the complementary single-arm study, SAS, and the study currently enrolling in China. There are also multiple post-marketing studies, including the post-marketing surveillance study, PMS in Japan. As shown here, and sort of the subsequent slide, the RCT will be shown in red, single-arm study in black, and the Japan PMS in blue. As you can see, these studies enrolled increasingly complex patients and lesions. The RCT enrolled lesion less than 14 centimeters in length with no prior stent. The single-arm study included longer lesion and instantly stenosis. The Japan PMS had no exclusion criteria, and the first 907 patients treated with Zilver PTX stent in Japan were enrolled. This slide shows the baseline demographics and comorbidities of the Japan PMS as compared to the pre-market studies. The Japan PMS patient was significantly older and had a higher prevalence of the diabetes and the renal disease. The baseline lesion characteristics of the Japan PMS compared to the pre-market studies shown that Japan PMS lesions were more complex, including being significantly longer and having significantly more instantly stenosis, fewer patent runoff vessels, and a greater incidence of CLI. The Japan PMS enrolled 907 patients with 1,075 lesions treated with 1,861 Zilver PTX stents. 24 months follow-up is currently available of the 624 patients, which represents a follow-up compliance of 86.5%. Patency was assessed by ultrasound at site where this was standard of care. There was no significant difference in demographics, lesion characteristics, TLR rate, or thrombosis rate for patients who underwent ultrasound compared to patients who did not undergo ultrasound follow-up, demonstrating that the ultrasound group is representative of the entire Japan PMS patient population. At 12 months, stent integrity was evaluated for more than 1,100 stents in Japan PMS, yielding the fracture rate of 1.5%. This rate is low and similar to the fracture rate in the pre-market studies, despite the more complex lesion in this study. The next assessment for stent integrity at 3 years and 5 years. In looking at thrombosis occlusion, it is important to remember that SFA stent thrombosis can be difficult to distinguish from total occlusion caused by restenosis. And there is not yet a standardized classification for stent thrombosis in the SFA. Accordingly, the following results from the Japan PMS include all site-reported total occlusion of suspected thrombotic origin. The site-reported thrombosis occlusion rate in the Japan PMS was 3.0% through 12 months and remained low at 3.6% through 24 months. This 24-month thrombosis occlusion rate is similar to the rate with Zilver PTX in the RCT and single-arm study, as well as the rate with bare Zilver stent in the RCT. And the 30 days of 12 months rates reported in literature for bare metal stent and balloon angioplasty, which range from 2% to 4%. Thus, this slide showed the 85% freedom from TLR rate through 24 months in the Japan PMS. Here are the freedom from TLR results for the Japan PMS compared to the pre-market studies. Because longer-term follow-up has been completed for the pre-market studies, the time scale is expanded. As you can see, the freedom from TLR rate in Japan PMS through 24 months is similar to that in both pre-market studies. This slide shows the clinical benefit defined as the freedom from persistent or worsening claudication, breast pain, ulcer, or tissues. The clinical benefit rate through 24 months was 79.3% in the Japan PMS. Here are the clinical benefit results for the Japan PMS compared to the pre-market studies. As you can see, the clinical benefit rate in the Japan PMS through 24 months is similar to that in both pre-market studies. Here are the results for primary patency for those patients who underwent ultrasound follow-up. The primary patency rate is 72.3% through 24 months. As previously mentioned, additional analysis demonstrated that the ultrasound group is representative of the entire Japan PMS patient population. As you can see, the primary patency rate in the Japan PMS is also similar to that in both pre-market study. In summary, there is a large amount of clinical data showing positive results with the Zilver PTX drug-eluting stent in femoropopliteal arteries, ranging from carefully controlled level 1 evidence from the RCT to large global real-world experience from the single-arm study and Japan PMS. As expected, the patient population and region characteristics become more challenging in real-world all-comer studies. In conclusion, the large PMS results through 24 months confirm the long-term benefit of the Zilver PTX technology, and the consistency across studies reaffirmed the established performance of the Zilver PTX drug-eluting stent. Thank you for your attention.
Thanks for a great presentation. And I guess as a practicing clinician, this long-term, large, robust data across different patient types, different countries, long-term 5-year data, I mean, this is exactly what this field needs. I want to ask the 3 panelists across the stage here for quick snippets. So, Sean, from a decision about using a device, how does this data impact you, given the magnitude, the long-term nature, the cross the continents sources from it?
I think it provides a lot more confidence. One of the concerns early on from the U.S. randomized clinical trial was the short lesion length, and really seeing longer lesion lengths and very similar patency, TLR, and clinical benefit curves actually emphasizes the fact that the U.S. trial data was valid, and it's valid even through longer lesion lengths. Pretty exciting.
Dr. Suzuki, in Japan, when you look at data like this, how do you feel about this reaffirming your decisions to allow a device like this to be used? And are you expecting companies, sponsors to do more of this type of work going forward?
Yes. Yes, I was really surprised that real-world data is similar to preclinical study. Because we think the clinical study has some limitation in a safety matter, but this all-comer data is very similar. So it's very nice to have post-market surveillance data in review process.
And Dr. Malone, just quickly, how impactful is post-market data like this when you're thinking about approval with conditions of doing post-market and things like that, and you look at this data, how impactful is stuff like this to you?
So as part of our recent goals, we've been looking at how to shift data from pre-market to post-market, and seeing data like this helps increase our confidence that that path and striving to maybe moving some aspects post-market may be valuable. However, it appears they did a good study and collected the appropriate data, and that helps also.
Great. Thank you. Excellent presentation.
Thank you.